Hey everybody, welcome back to my channel. Today I will be doing a follow-up on my previous video called Woman in a Vegetative State who was in a long-term care facility and was raped and impregnated by her nurse. Before I get into lessons that can be learned from this case, brief update. The nurse that was accused of raping and impregnating this woman has now been charged with sexual assault and vulnerable adult abuse. He has pleaded guilty. Now, what I'm going to do is explain what vulnerable means in this particular case. It can be a person of any age that is in need of special care or protection due to a chronic health issue, severe mental health, or illness. These people are more at risk of abuse or neglect. Now, I'm going to be looking at my notes as I talk, but I want to give some tips on things that you should be doing in order to protect a family member that you have in a short or long-term care facility or in the hospital, because they are vulnerable. Now, tip number one, it's very important that you visit your family member on a regular basis at different times of the day. Also, it would be a great thing to get your family and friends involved, because when it comes to, say, short-term care, that may be up to 30 days or a little bit more, or long-term care, which could be for years, like this young lady that was impregnated. It's important to be involved, show up unannounced, so that the workers would never know when you're coming. They just know that you are. And that's so important. Now, when you do visit, you need to do a body check every time you visit. Pull their blankets, their sheets off, their gown, their clothing, whatever they're wearing, and check them. Check them for bruises, for bed bugs. Make sure that if they're wearing diapers, make sure that they are clean at all times. If not, then you should inform the nurses, especially if it becomes a pattern. If when you visit, you notice that your loved one is laying in feces and urine. Now, number 3, always be pleasant. Always remember that you're leaving your family member. So you need to be nice to the caregivers. Also, every long-term and short-term facility should have cameras, and cameras with audio. Not only do you want to see, but you want to hear what is going on, because abuse isn't just physical or sexual. It can be verbal. And so you should check with the staff at the facility to see if cameras are available throughout the facility. Number 4, make sure to provide updated emergency contact information to the facility. In the event of an emergency, they need to be able to get in contact with you or any designated family member or friend. Also, that it's the same when it comes to giving authorization for who can visit. keep that information up to date. Now, if you have any concerns regarding your family member, maybe there's a question about their hygiene, you feel that they're not receiving baths as they should, maybe their room isn't clean, maybe they aren't, their bedding isn't clean. Any questions that you may have or concerns, you need to take it not only to the direct staff, but to a supervisor. Now, if your concerns are serious, very serious concerns, where you may think that that person may have been abused or is being neglected, inform a supervisor. Don't just give that information to a direct care worker. Inform a supervisor. Also, it's very important that you document that information. Also, don't leave it up to the supervisor or anyone else in the facility to take care of it, to hotline the situation. You should also hotline your concerns, and someone from the state will come out and investigate. And they generally will get back with you to let you know whether a case has been substantiated or not. And document, document, document. Keep a record of every time that you visited and any concerns you had, and the fact that you did talk to direct staff and supervisor, get names. Also, very important to be pleasant. Be pleasant. Don't have an attitude with the people that are taking care of your family member. Don't get excessive with complaining. Save it for when there are legitimate concerns that you may have. I'm telling you, I've worked in residential, as I've stated in my previous video. Don't complain so much that every time you walk in there, they're going to themselves, oh my God, here she come, here she come, here he comes. What they gonna complain about today? Don't do that. Be pleasant, very important. If you have concerns about staff being rude or doesn't seem to want to be bothered or to answer any questions that you have, take that to a supervisor also. Because if they're not going to treat you in a respectful way, what do you think about your vulnerable loved one when you're not there? But like I said, very important. They're humans too. Don't continually come to them with complaints. Also, say nice things. My family member looks nice today. Things such as that. Also ask questions. You want to know what they ate that day. Did they get their medications? When will they get their next medical examination? If they're getting any type of therapy, physical, occupational therapy. You want to know things like that. It's very important that you let the caregivers know that you are concerned about your family member. Also, not last, I got another very important thing. And this may be more so for caregivers, nurse assistants, nurses, janitors, maintenance persons, all levels, all levels. Your level, your position is irrelevant when it comes to being along with a patient. You should always have an additional person with you as a witness, and that's for liability purposes. Not only do you want to protect that patient, you want to protect yourself. Now, last but not least, always remember that that's your family member, and it's your responsibility to take care of that person. Yeah, everyday life, it's true, goes on. You have to go to work. You have to raise children at home. There are a lot of things that you have to do, but you also have to watch out for your family member. You have to show that you care. Again, they are vulnerable to abuse and neglect, and you could help to prevent abuse and neglect happening to your family member by making sure that you are involved in their life. Caregivers, yes, they get paid. They're doing a job, but that family member also needs that love, that presence of their family. If you have any questions regarding this topic, or if you are a caregiver or a person with a family member currently in a short or long-term facility, and you have any comments or additional suggestions or tips, please leave a comment below. Now, please, everybody, please show your love, your support by giving me a thumbs up and subscribe to my channel. I really appreciate it. I think that's about it for today. But again, let me know, and I will be talking in a future video about or providing tips to anyone that may be looking to place a family member into a short or long-term facility. Have a good one.